Welcome, one and all. My name is Anna Lempriere. I work for the Cornwall Memory Cafe Network, supporting carers and people living with dementia to access services, make referrals, and really help them find a way to get more support. This is part of Disability Cornwall, and we've decided to create this podcast interviewing experts and people with lived experience on dementia to be able to share all sorts of interesting and informative and supportive information. So sit back and enjoy, and also share the podcast with your friends. It's relaxed and inclusive and welcoming, and thank you for listening. Welcome everybody to our Dementia Toolkit video series, a one-stop shop answering all your questions on everything dementia related. Simple educational advice from people with lived experience and professionals in their field. We aim to provide support that's personalised to help you on your dementia journey. Welcome everybody. I am very excited today to be chatting with Julie Fleming, who is absolutely gorgeous in every way, and she is a specialist community dietitian for the West, working in the community hospitals, and has been a specialist, or is a specialist, for 14 years of diabetes and all that is around diabetes. You're also a fitness instructor for 27 years, supporting people to build strength, condition their bodies, and working in West Cornwall. And you were saying before we pressed record that the tradition of, if you like, a dietitian is that everything that you share with the community and your patients and the people that you support is science and research based, so and evidence based. Let me get that right, evidence based. So hope that's a good enough introduction. Is there anything else you want to share about yourself, Julie, before we get to the questions?
Oh, thanks, Anna, for the introduction. Yes, dietitians are evidence-based, which means we kind of have to go where the research is. And if there isn't really any robust research, then we use our learning and our clinical judgment to decide sort of a way forwards. We continue with lifelong learning while we're actually registered as a dietitian. So we have continuing professional development, and we meet as a team and share new learning with each other. It's great for development all the way through.
Amazing. And you're working in Cornwall, and how does your work unfold then? Tell us a day in the life of Julie.
A day in the life, right. So we look at the referrals that we get from the community hospitals, and I cover the inpatients there. And I make a plan of which hospital I'm going to visit that day, who I'm going to see, have a look at the notes online, get a bit of information together, and then I will go and see my patients, talk to the ward staff. It's all very collaborative, talk to housekeeping, see how we can support each person to have a good nutritional intake to meet their requirements. Lots of admin then with writing up notes, and if somebody has been discharged, then we'll make a decision as to whether they need some further support once they're in the community.
And your patients then, they're not just people living with dementia?
No, there are elderly. They, as a rule, they tend to be fairly frail elderly, and they quite often do have some dementia of varying degrees.
Okay. All right, so let's start with the questions then. So I think the most important is around the health question for people to prevent dementia or slow it down? Or tell us a little what research is out there for us all to take better care of ourselves and our brains.
Yeah, well, it's really interesting actually, and there's a lot of crossover in terms of the nutritional advice for different risk factors for dementia. So we're calling it risk reduction. We can't guarantee prevention, but we're going to look at risk reduction. And when we say diet, we mean someone's overall intake, not just a weight loss diet, which is what everybody seems to think of when they hear diet. And the other thing that we need to bear in mind is that studies can show associations between diet and cognition, how your brain works, but they can't necessarily say cut and dried, if you do this, this is what will happen. So we have to sort of bear that in mind. Also, a lot of the studies are based on people self-reporting what they've eaten and drunk, and often unintentionally, people are not necessarily that great at being accurate in remember everything that they've eaten and drunk over a period of time. So taking that all into account. So the diets that overall have got the best potential benefits, one of them is the Mediterranean diet, which I think most people have heard of. And this has a big emphasis on fruit, veg, whole grains, such as granary bread or oats, also fish and the healthier fats. So we might think of olive oil or avocados. That has definitely been associated with some good cognitive benefits. The other one is called the MIND diet, which is a combination of the Mediterranean diet and also the DASH diet, which is really big emphasis on low salt. So we're looking at the sort of blood pressure side. And that sort of focuses on leafy greens, berries, nuts again, fish, and having some red meat, but having it limited and not much in the way of sweet foods. Really, overall, any way of eating that is heart friendly is going to be brain friendly as well.
Yeah. Okay.
If we looked at, should we go on to the other risk factors and the dietary advice about? Okay.
Yeah.
So this one, alcohol intake, potentially contentious. So there have been studies up until recently that shows that light or moderate drinking may actually protect against dementia.
Wow.
But there's just been there's just been a new study, which is over 300,000 people, that showed there is no safe level of alcohol intake. So any amount of alcohol will increase the risk of dementia. But the more you drink, the higher the risk.
Okay.
So we've always known that heavy drinkers have got a much greater risk of developing dementia. But this showed that any amount of alcohol may increase risk. And this is because alcohol is actually, it's what we call a neurotoxin. So it has a negative impact on memory, and it actually stops your brain creating new nerve cells. And the overall sort of comment on it was if someone's brain function is slowing, you don't want to take something that's going to slow it down even further.
No. It does make sense, doesn't it? It's like, it does seem to sort of, I don't know, maybe this is really judgmental, but it does kind of stupefy you when you drink.
Yeah, it is a depressant. But I know people drink.
It's a depressant.
Yeah. People drink to perk up, but it's actually works on your brain as a depressant.
And do you think that's because it's stripping the sort of natural hormones and chemistry in the brain that are so special for the body, like serotonin and dopamine and all these sort of things?
I couldn't find any research on that specifically. It seemed to be more that because it is a neurotoxin, it has a really negative effect on the memory and on the actual creation of new nerve cells, which is what we need to keep our brains healthy. We need to have those nerve cells in the brain. You know, we need to be able to grow them and make them adaptable as much as possible. And alcohol does seem to interfere with that.
Wow. Okay, that's big then.
Yeah, that was quite big. So the other ones are probably what you might think. So don't smoke. Smoking is bad. And as I said earlier, it's bad for your heart. And if it's bad for your heart, it's bad for your brain.
Okay.
If you've got any pre-existing medical conditions like high blood pressure or high cholesterol, try and get them under control, so manage those. And if you've got type 2 diabetes, try and get that under control. And I might talk a little bit about type 2 later, if that's okay, because that's a bit of a standalone thing. Exercising regularly, really important. So aiming for at least 150 minutes of at least moderate exercise per week. And this will be different things to different people. So if you're not a fit person, going for a walk at a quite a slow pace, you may find that really hard.
Yeah.
Whereas if you're quite a fit person, let's say you're a runner or something, you'd have to really go for it to get the same effect. So it's finding what's a moderate exercise level for you. And a good guide is you should be able to talk but not sing while you're doing the exercise.
Okay. That is so you want a bit of a sweat, that there's been some exertion, that there's a level of the heart rate going up.
Yeah, that's right. So you feel a bit warmer and you may be just slightly out of breath. If it's too easy, it's lovely, but it's not really going to give you the benefits that it could do.
Yeah. So you want that blood being oxygenated, really, and
you do. And you want it being pumped up to the brain, because it will deliver the oxygen, and the blood carries other nutrients as well. So that will carry nutrients to the brain. It will help all our blood vessels grow and stay healthy. So again, you've got those nutrients being delivered. It can help reduce the risk of high cholesterol, blood pressure, helps with weight maintenance. It's not massive for weight loss, but it absolutely helps for weight maintenance. It also helps your brain form new connections. So as an instructor, fitness instructor, I will start my classes with a little dancey warm-up. Nothing too tricky, but just enough to make people go, oh, what are we doing now? And we might do those same moves for a few weeks. And you can see on week 1 of introducing a new move, half the class are going to be a little bit all over the place, but it's all fun. We all have a laugh. It's absolutely fine. It's nothing too serious. But a few weeks further on, everybody can do it, because they've opened up what we call neuromuscular pathways. So the messages from the brain to the muscles, they've opened up new pathways, so they've learned to move in different ways.
It's amazing.
It is
amazing.
It is.
Wow.
So so exercise is good. Participating in lifelong learning. So I think we've all heard about learning a new skill, maybe taking up ballroom dancing, something like that. But we have to keep learning new things. So if you've mastered your ballroom dancing, although personally I'm not sure anybody ever would, but if you have mastered it, then you need to think, okay, I need another mental challenge now. So think of something else. And that helps our brain's ability to adapt and to reorganize itself, which is something that we need to keep on top of. Another important one. Sorry, did you want to ask me something there?
No, I just keep going. I'm loving this. My brain is going but I won't speak.
Another one is to prioritize good quality sleep. So sort of 7 to 9 hours, because poor sleep patterns have a really negative effect on brain health. Another biggie is maintain social connections. So I think we've all heard about this. Social isolation, which is not easy to say, is a risk factor. as is depression. And with that in mind, try and protect your hearing. And if you need to wear hearing aids, wear them. They will preserve your hearing for longer. So I only learned this recently because my aunt is at the start of her dementia journey, shall we say.
Yeah.
And she's got significant hearing loss. So my husband and I took her to have her hearing checked, and we got new hearing aids for her. And the audiologist was saying she sees so many people in later life that have got quite profound hearing loss, whereas if they had started wearing hearing aids 20 years earlier, they could have preserved a lot of their hearing.
Wow.
I know. That's what
Why
I
is
thought.
that then? What's
because
going
of
on
all,
there?
yeah, the nerves that are involved with hearing, actually hearing and sending the messages to the brain, they are kept in better condition if they are stimulated by hearing things. So if you're deaf and you can't hear things very well, they lose that stimulation and they just stop working as well. It's like everything, you have to use it to lose it. So once we got that message, my husband also has now got some hearing aids.
Wow.
Much to his delight.
That's making me think of muscle memory, like you were saying. If the memory for the nerves isn't stimulated, then it forgets.
All parts of our body have to be used and stimulated in some way, otherwise it's called atrophy. So it's basically everything gets a bit flabby and stops working as well. It gets a bit lazy, it just degenerates. So all these things about if you don't use it, you lose it, which is a bit of an aside, but it's the same with mobility. So if you never reach behind you, you will never be able to reach behind you at some point. If you don't keep that action going, your shoulder gets too stiff, and one day you'll find you can't. So even if you're doing armchair exercises, it's basically move everything in as many directions as you possibly can.
Amazing.
The body is such a wonderful thing, and how it all works together in synergy. It really is quite amazing. I think probably the sort of the big thing was eating a healthy diet and maintaining a healthy weight. So we all need to be eating less processed foods, less salt, less sugar, less high saturated fats, and mainly from animal sources. A lot of foods are high fat and high sugar. So cakes, biscuits, fizzy drinks, if you're the full sugar ones, they're not great. But they're quite attractive to people. So it's not necessarily stopping them, it's just reducing intake of those things. Processed meats is another one. So things like sausages, bacon, ham, chorizo. Again, we're not saying don't have them, but we're just saying don't have them. Don't have them too often. So you can still have your bacon sandwich on a Sunday morning, but you just wouldn't have it every day. And that covers so many aspects of health, which, as I said, is all interlinked. That's kind of one of the main things.
Amazing.
Do you want to know something about some individual nutrients?
Yes, there's one that springs to mind that I've heard about is magnesium is very good. Is that nutrients? Is that what you're talking about? Those
sort of vitamins and minerals. So magnesium, there's quite a lot out there on magnesium actually, but all of it needs further research to confirm. But they found that people who had higher levels of magnesium had a lower dementia risk. Well, it was linked to a lower dementia risk. But if you've got too higher levels of magnesium or too low, that's also a risk for dementia. And very high levels of magnesium, so people who over supplement because they think more is good, is actually really dangerous and can eventually lead to death. So we're not looking for more is not necessarily better.
No.
And actually, there was a study that showed that having a good level of magnesium showed better effects in women.
Okay.
Don't know why, but
and because there's different kinds of magnesium as well, isn't there? Or do you think? Yeah, I don't know. But anyway, but it's all right for women. Women definitely
better effects in women. The UK guidelines are 375 milligrams a day. But again, bearing in mind we're always food first, if you can get it through your diet, the nutrients tend to be more what we call bioavailable. So your body can access them and use them better than if you're taking a supplement.
Okay.
The only way you'd really know if you were deficient is if you had a blood test.
Okay.
And if you were deficient in any of the vitamins or minerals, then your GP may well suggest that you do take a supplement.
Yeah.
But otherwise, if you've got a decent diet, you should be covered. So for magnesium, the good sources are, again, whole grains, nuts, seeds, the legumes, which are the beans, the lentils, the chickpeas, peas, dark chocolate.
Oh, lovely.
In moderation. Avocados, bananas, and the leafy greens again. So that's magnesium.
Okay.
So yeah, magnesium has good potential.
Amazing.
Another one that had some potential was caffeine. Well, specifically coffee. So there was a Chinese study and it found that older people who drink coffee regularly have got a lower risk of developing dementia. But only if it was unsweetened and caffeinated.
Okay.
And it's
good, and the good quality stuff, the stuff that's
the decent
not
stuff.
Nescafe or powdered.
No sugar. It looked as if more than 3 cups a day probably had a bit more of a significant effect, but actually any amount had a positive effect. Now, some people react not in a good way to caffeine because it makes your body produce adrenaline. And if you have it later in the day, obviously it can interfere with sleep. So you do need to sort of bear that in mind. Again, further studies were needed to confirm, but that looked as if it could have some potential. Wow. Another one is vitamin D. So lower vitamin D levels has been linked to a higher risk of Alzheimer's disease. But the mechanism wasn't clear, so it does need a bit more research. But generally, everybody should be having enough vitamin D because it's important for bone health. And we can get this from sunlight, but only between April and September.
Okay.
And only when your shadow is shorter than you are. So that's roughly between 10 o'clock in the morning and 3 p.m.
Wow.
Yeah, so it's quite specific. If you've got light skin, about 10 to 15 minutes, doesn't have to be in one go because you do not want to burn. And if you've got darker skin, you could have between 25 to 40 minutes. But again, try not to burn. This is just skin that's not protected by sunscreen.
Got you.
So that's why you might do it in short bursts. Diet-wise, you can get it in fatty fish. Some dairy products are fortified with vitamin D. And if you have non-dairy milk, so you might want oat milk or something, just check that it's fortified with calcium and vitamin D. Then, it's worth just checking.
That's a really good way of getting it.
Yeah. It's also in egg yolks. Some cereals are fortified and some spreads are.
Yogurts?
Yogurts, if they're fortified. If they're fortified, vitamin D is quite a big one. Older people are more likely to be deficient because they probably don't go out as much, and they're probably not showing as much skin.
Yeah.
So supplement. If you're not going out much in the summer or you're covered up, then it's 10 micrograms a day.
Okay. And vitamin D is usually a liquid form, is it? Or
no, you can get it in tablets
little
as
tablets.
well. Yeah.
Okay.
So it may well be in liquid, depending on people to find to be easiest to swallow.
Yeah.
Basically.
Okay.
There's another one.
So I would
zinc.
imagine then everyone could do with that, supplementing with vitamin D in the UK.
Yeah, wouldn't do any harm.
It can't do you any harm, can it?
No, that's one of the ones that probably you're right, everybody could do with it. Zinc was another interesting one. And again, it's better to try and get this through your food. So we're back to nuts and seeds, pulses, whole grains, dairy. Shellfish is another one. Again, needed a bit more research on that.
Okay.
I think the odd ones. Do you want to hear about the odd ones?
Yeah.
Okay. Ginkgo biloba, which is quite popular for quite a lot of things. There was absolutely no conclusive evidence on that at all.
Okay.
Vitamin E, it's an antioxidant, and so you would think it would be helpful, but they haven't really found any links that shows that it helps with reducing risk, although it might have a possible role in slowing cognitive decline. So it might just make it go a bit slower. Sage. Yeah, go on.
And where would we get vitamin E? Is that?
It's in some fat. So avocado is quite a good one. Yeah, it's a fat soluble vitamin. So some of the good fats. Sage.
Yeah.
Took me by surprise. So several studies have shown some promising effects, but needs more research. And
well, how would you take sage then? Would you have that as the herb, that the leaf that's freshly grown in the garden, or is it a sage oil? Or
I suspect you'd have to take it as a supplement, because with all of these sort of natural herbs, it's like turmeric, you have to take shed loads of it for it to be therapeutic. So supplement would be good. One that I'd never heard of before was called Bacopa monnieri. I have no idea what that is. I suspect it's a herb, but don't quote me on that. And there was apparently it can be quite popular for people trying to reduce risk of dementia, but there was no difference between that or a placebo. So again, it needed a bit more research.
Okay.
Would you like to talk about type 2 diabetes?
Yes, definitely, because this is definitely linked to dementia. Yeah,
it is. It's really interesting. And they're discovering more about it as time goes on. So the reasons that it shows that type 2 does increase the risk of dementia. If you think about type 2, so one of the risk factors for type 2, but probably one of the biggest ones in the UK, is weight. So as a population, we're all getting a bit bigger. And so the incidence of type 2 is going up. It's not just the weight we carry all over our body, it's the weight we carry around our middle that is the problem, because it's not like the fat we carry maybe on our bottoms or our thighs. It actually produces inflammatory chemicals.
Oh.
And the inflammatory chemicals are what causes insulin resistance in the body, which is type 2.
Okay.
But it's also really bad for heart. So the body doesn't like to be in a state of inflammation. So it's that stuff we carry around our middle. If we can reduce that, which would be overall weight, then that's going to be helpful. But it damages, you've got a barrier between your brain and your blood, so it damages the blood-brain barrier, and it leads to inflammation basically in the brain. So as I said, the body doesn't like to have inflammation. It doesn't do well with it. This affects the amount of how the insulin works in the brain. So your brain also gets insulin, not just the rest of your body. And it helps control your food intake, and it regulates your cognitive functions, especially memory.
Okay.
So yeah, so emerging evidence is showing that you can get insulin resistance in the brain the same as we get insulin resistance in the rest of our bodies, and that can lead to Alzheimer's. But these studies have all said that they need more research to really understand why it happens. But one thing that did come out of it was the earlier you develop type 2, the greater your risk of dementia.
Okay.
So you want to, and as a population, we are developing type 2 at younger ages. So that's something to be aware of. If you've already got diabetes of any sort, then keeping your blood glucose in good order is really important. And if you're taking insulin, if you have repeated hypos, so where your blood glucose goes too low, that's quite damaging to brain health.
Okay.
And when I was working with people, mainly with type 1, so on insulin, we used to see those patients who had a lot of low blood glucose did tend to have the worst memories. They did. So that was anecdotal, but it has been backed up by actual evidence as well.
Yeah. Okay.
One really interesting emerging field is about gut health. So we've all heard about the gut microbiome.
Yes. Yes.
And this is implicated in everything. So heart, diabetes, dementia, you name it, it's implicated. And the way we can help with our gut health is to increase our fibre intake. Again, good sleep, reduce stress, reduce your salt, sugar, alcohol, and don't smoke. So if we can get our gut bacteria into a good state, then it's going to help reduce inflammation.
Wow. It's amazing, isn't it? It's amazing how we're starting to realise it's the whole body, isn't it? And it sounds to me like it's the lifestyle, isn't it? It's so many factors coming in. What about water? You haven't mentioned water. That's the only thing.
Hydration, good
hydration for the brain.
Good hydration. Ideally, it would be water, but it doesn't have to be. So you can count tea and coffee, and we get a certain amount of hydration from fruit and vegetables. But yes, a good few glasses of water a day help your brain work better. So if your brain is well hydrated, you're perkier, you don't feel as sleepy, you're less likely to have headaches. Overall performance has been shown to take a bit of a dip if you're not adequately hydrated. So keeping hydration levels good. If you're not used to drinking very much, increase gradually. Otherwise, you will spend an inordinate amount of time in the loo. So just increase a little bit day by day, week by week.
And then the body will get used to it.
Exactly.
This is so interesting, Julie, and we're sort of coming to the end now, and I wonder if for somebody that's caring for a loved one, supporting somebody that's living with dementia, and how challenging it might be to take care of that person and amp up their health and well-being, recognizing all these things. I've got a few people in my mind that I know that are living on their own, and how can people out there encourage them to be adopting healthier choices? If how could they do that? Would there be 3 things that you could think of that we might go, all right, this is doable? What could we do?
Yeah, I think generally, obviously having the healthier diet, being a bit more sociable. I would say if somebody is living on their own, having some sort of social contact, because that will be very mentally stimulating. And trying to do some sort of exercise. I can appreciate that some people will have mobility issues, but as I said, you can do chair exercises. I think the social aspect is important. People eat better if they eat with somebody else.
Yeah.
And they're more likely to do some sort of exercise if they do it with somebody else.
Yeah, agreed. That's great. So seeing if they can do a small amount of exercise, socializing, and that a lot of the time that's linked to exercise because they've got to get out of the house, and that's moving the body. That's brilliant.
If somebody's really struggling to eat very much, if they haven't got a good appetite, then we would recommend food fortification. So your priority would then be not becoming unhealthily underweight, if you know what I mean. We keep trying to keep a healthy weight, so not too much, not too little. So then we would definitely be saying have full fat milk, add butter to your mashed potatoes, have full fat yogurts, a bit of grated cheese and some soup. So if somebody's eating a very small amount, you're basically adding fat to it and some protein if you can, just to give it a bit more of a nutritional punch.
Yes, wonderful. Thank you. It's been such a pleasure. And is there any links or anywhere that you would direct people to learn more or to get more support or advice?
Yeah, I mean, there's Dementia UK will obviously be one of them. The NHS, you can Google on the NHS as well. The food fortification for some really good ideas and some recipes for nourishing drinks. If you put in your search engine Cornwall Joint Formulary, and there is actually a website if you want me to read that out. Okay, so www. Eclipse Solutions, all one word, .org.
Okay, and I can put that in the show notes as well.
Great.
Eclipse Solution
.org.
I'll put that in the show notes. All right, well, thank you. That's
you're
amazing.
Welcome. Thank you.
Fascinating. Oh, it's a pleasure, and it's going to kick me up the bottom as well and get me get out there, get fit.
Good luck.
Oh, lots of love. Thank you.
Thanks. Bye-bye.
This video was produced by Discover Voices, part of Disability Cornwall and Isles of Scilly. To check out all of our content, simply search Discover Voices on YouTube.